next part of the temporal bone is the petrous part. This is petrous part and it is pyramidal in shape, having a base which is merged with the inner surface of the squamous part of the temporal bone and also with the mastoid parts. And apex, this is apex which is projecting forwards and medially, and it forms the boundary of the foramen of lacerum. Here you will see this apex, it forms the boundary of the foramen lacerum here, which is present in between the greater ring of sphenoid and medial part of the petrous part of temporal bone. And the tip of the petrous part, it is connected with the petrosal process of dorsum scelli of the sphenoid bone. I discussed this one while I was discussing the sphenoid bone. I am repeating once again, the ligament extending from the tip to the petrosal process of the dorsum scelli from the petrosphenoid ligament, deep to which or below which the abductor nerve is passing. Then come to the borders. There are three borders: anterior border, superior border and posterior border. The anterior border, the lateral part, it is fused with the squamous part, and the medial part, this one, it articulates with the greater ring of the sphenoid. If you see the articulated skull, the lateral part of the anterior border, it is fused, but the medial border, it articulates with the greater ring of the sphenoid bone and leaving a gap here called foramen of lacerum. The sulcus is formed on the undersurface after articulating with the greater ring of sphenoid, and this sulcus is called sulcus tubi, and the sulcus tubi lodges the cartilaginous part of the pharyngotympanic tube. Here at the junction of the anterior border of the petrous part and the squamous part, there are two bony canals. This is upper canal, this is lower canal. In the upper canal, it is for the passage of tensor tympani muscle and the tympanic branch of the middle meningeal artery. And the lower canal, it forms the bony part of the auditory tube. And a partition in between these two is there. This partition is called septum musculotuberous. Then come to the posterior border. This is posterior border. This border, it is also having anterior part and posterior part. The anterior part, it articulates with the lateral margin of the basic occiput and lodges the inferior petrosal sinus. If you see the articulated skull, you see the inferior border is here. This is inferior border. It articulates with the basic occiput, and here you will get the inferior petrosal sinus draining into the cavernous sinus here. But the posterior part, this part is free and it completes the jugular foramen. This is jugular foramen together with the jugular notch of the occipital bone. This is jugular notch and this is the jugular foramen. So in an articulated skull, you will get both the foramen lacerum and jugular foramen, but not in a single temporal bone or occipital bone or sphenoid bone. You will not get the foramen lacerum and jugular foramen. Then come to the superior border. This is superior border. The superior border, it lodges the superior petrosal sinus. I told you here, the inferior border, inferior petrosal sinus, and the superior border, superior petrosal sinus. Both the sinuses, they drain into the cavernous sinus, which are present on each side of the sella turcica. The superior border also, you will get the attachment of lateral margin of tentorium cerebelli. The tentorium cerebelli, it is attached along the margin of the transverse sulcus of the occipital bone, then along the superior border of the petrous part, then posterior clinoid process up to the anterior clinoid process. So the superior border, you will get mainly two structures. One is superior petrosal sinus and another one is the attachment of lateral margin of tentorium cerebelli. Then come to the surface. Between the anterior border and superior border, this is called the anterior surface. In the anterior surface, close to the apex, here there is a depression. This depression or impression called trigeminal impression because it lodges the trigeminal ganglia. It is a sensory ganglia of the trigeminal nerve, and this ganglia it is lodging within a pouch of dura mater which is called cavum trigeminally or Meckel's cave. And this elevated area behind this impression and close to the superior border is called the arcuate eminence. And this eminence or elevation is caused by the upward bulging of the superior semicircular canal of the internal ear. And the plate of bone lying between the arcuate eminence and the squamous or temporal bone is called tegmen tympani. In the tegmen tympani, there are two small openings are there. You can see the two openings in this bone. Of these two openings, the medial opening for the passage of greater superficial petrosal nerve and the lateral opening for the passage of the lesser superficial petrosal nerve. Then come to the posterior surface. This is posterior surface in between the superior border and posterior border. In this surface, there is one opening here, which is about 1 centimeter long, and this canal is called internal acoustic canal or internal acoustic meatus. And this foramen or this meatus, it transmits the motor and sensory root of the facial nerve, then vestibulocochlear nerve and internal auditory vessels. And this meatus, it is separated from the internal ear by a transverse partition called septum transversum. And lateral to this meatus, there is a oblique slit. This oblique slit is called the aqueduct of vestibuli for the passage of ductus and succus endolymphaticus of the internal ear. This indistinct depression is there above the slit and below the superior border. And this fossa is called subarcuate fossa, which lodges a process of dura mater. Then come to the inferior surface. This is inferior surface between the posterior border and anterior border. There is a opening on the inferior surface, a large opening, and this opening for the internal carotid artery. And this carotid artery enters through the inferior surface and comes out through the apex like this. So if I show you the direction of the artery, it is like this. It passes through the inferior surface and comes out through the apex, forming a inverted L-shaped course within the petrous part of the temporal bone. And this artery surrounded by the sympathetic plexus of nerve related to the anterior wall of the middle ear cavity. Then close to the apex there is a rough area medial to the opening. This is opening, so there is a rough area here. This area for the attachment of tensor veli palatini and tensor tympani muscle. And a depression lateral to this opening is called the jugular fossa. And this jugular fossa, it lodges the superior bulk of internal jugular vein. And there are some structures in between this opening of internal carotid artery and the jugular fossa. And from anterior to posterior, this is the anatomical position. From anterior to posterior, that means from this side to this side. If we see, there are mainly three structures. If you can remember in this way, T, G and C. T for tympanic branch of glossopharyngeal nerve, and G for ganglia of the glossopharyngeal nerve. Of course, it is the inferior ganglia of the glossopharyngeal nerve, and C for cochlear canaliculus or aqueduct of cochleus. Then another opening is there, sometimes there, on the lateral wall of the jugular fossa. Here you can see this opening. This opening is called mastoid canalicus, through which the structure transmits is the auricular branch of the vagus nerve. And another area is there, lateral and posterior to the jugular fossa. This is called the jugular surface, which articulates with the jugular process of occipital bone, forming a primary cartilaginous joint. What are the parts of the ear which are of adult size at birth? Number 1, the middle ear cavity. Number 2, the internal ear. Number 3, mastoid antrum. And number 4, the 3 ossicles of the middle ear, that is malleus, incus and stapes. And sometimes another question is asked, what are the parts of the ear that are present within the petrous part of the temporal bone? The bony part of the auditory tube or pharyngotympanic tube, then middle ear cavity, and also the labyrinth of internal ear. And regarding ossification of the temporal bone, it is membranocartilaginous in ossification. That means some parts are ossified from the membrane and some parts from the cartilage. The parts which are ossified from the membrane are the squamous part and the tympanic part. And the other parts like petromastoid part and the styloid process, they are ossified from the cartilage. And lastly, I will hold the temporal bone in anatomical position. You have to hold the bone in such a way so that the thin expanded squamous part of the bone is directed upwards. The thicker mastoid process is directed downwards and backwards. The elongated zygomatic process faces forwards and medially, and the lateral aspect of the bone, it presents the external auditory meatus, which determines the side of the bone. So this is the bone of left side, and you have to hold the bone in this way. And this is the temporal bone of right side, you have to hold the bone in this way. So this is the anatomical position of right and left temporal bones.